Question is that this bill be now agreed to in principle. I call the member for Sydney. The member for Sydney.
Thank you, Mr. Speaker. I congratulate the New South Wales Government on the Drug, Misuse and Trafficking Amendment to medically supervised injecting centre bill, which allows continued operation of the King's Cross Medically Supervised Injecting Centre, known as the MSIC. I move the motion to establish the MSIC after hearing from experts, users and their families about the tragic impacts of drugs on people's lives at the 1999 Drug Summit. The centre opened in 2001 to help drug users stay alive, to avoid overdose and disease, remove street drug use and provide a path to treatment. The MSIC's nearly 10 years of operation, repeated independent evaluations, including the latest KPMG report, have shown that the centre is meeting its aims. I strongly support lifting its trial status. Drug use should be treated as a health issue with compassionate and effective solutions like needle exchange, methadone, and the smart recovery programs that prevent and reduce disease and harm and help people get back on their feet. Police and justice resources should focus on drug dealing. Up to July 2010, the MSIC had successfully managed 3,576 drug overdoses with no deaths on site. Ambulance call-outs for overdoses in the King's Cross precinct dropped 80% after the centre began operations, and there's been a 20% drop in overdose presentations at St Vincent's and Sydney hospitals, with most overdoses coming from other areas and users unaware of the MSIC. The KPMG evaluation reports that overdose-related deaths in the King's Cross area have trended down since the MSIC began operating. In fact, two of my constituents from Darlinghurst just recently told me in an email that they noticed a big drop in the frequency of ambulance sirens since the centre opened. They, like many in my electorate, welcome this bill. Early intervention of overdose prevents serious brain damage and it reduces the burden on the hospital emergency department. The centre has helped slow the spread of blood-borne infections, with the KPMG evaluation showing a significant decline in HIV, hepatitis B and hepatitis C infections between 1999 and 2009, while other parts of New South Wales experienced an increase. MSIC clients reported increased knowledge about vein care and safer injecting. The KPMG evaluation shows that the MSIC clients are increasingly accepting referrals into drug treatment through its dedicated case referral coordinator. It's made 8,644 referrals to drug treatment and counselling, despite the many difficulties associated with engaging people addicted to drugs into treatment programs. Frequent drug users are the most likely to accept referrals, and according to the KPMG, 40% of MSIC clients had no prior contact with drug treatment services. The KPMG report identifies that the MSIC builds trust relationships before connecting drug users with appropriate services, including through brokerage funds to buy access into programs that are full. The report does identify that waiting periods are a key barrier to treatment, and I do again call for increased funding to public drug services so that those who are ready to get into treatment are able to do so. The KPMG figures show that public injecting and used syringe sightings have been reduced by half since the centre opened. This is something that is incredibly welcomed by my constituents. Previously, residents would regularly report stepping over people with needles hanging out of their arms and not knowing whether they were dead or alive or high. More than 90% of clients said that the centre helped them reduce injecting at public places, and a 2007 independent evaluation of the centre estimated that 300,000 public injections had been prevented. The 2008 SAHA International Economic Evaluation of the Medically Supervised Injecting Centre, or mouthful, showed that the centre saves the government 1.1 million a year in prevented overdoses, HIV, hepatitis infections, drug crime, public amenity and health costs. The report concluded that savings for prevented deaths would cover the centre's operating costs 32 times over. The centre is funded through the confiscated assets from serious crime, including from drug trafficking. It reaches a marginalised and vulnerable population of long-term injecting drug users who don't engage with services and nearly a quarter of them are ex-prisoners, or former prisoners. Most visits are made by long-term, frequent drug users, and which the centre was intended to target. There are 12,050 individuals currently registered, and 621 and 47 visits recorded to date. The KPMG reports demand for the medically supervised injecting centre remains constant, with about 70,000 visits annually. The centre is needed. It's likely to be needed in the future. Its trial status should be removed. It should not need to continue as a trial when there is clear evidence that this approach and the centre work well. There are about 70 medically supervised injecting centres around the world, and the Queensland Government is carrying out a needs assessment for centres in Brisbane's Fortitude Valley and on the Gold Coast. The centre has earned support from 70% of local businesses and 78% of local residents, and the KPMG report shows that this support is growing. The nearby Wayside Chapel, St John's Anglican Church and St Canice's Church, who work with those who are suffering from severe addiction and living on the streets, all support the MSIC. Family Drug Support, which works with families of people with drug addiction, has also supported the centre from the start. Other supporters include the Australian Medical Association, the New South Wales Nurses Association, the Royal Australian College of Physicians, the College of General Practitioners, the Royal Australian New Zealand College of Psychiatrists, the Australasian College of Emergency Medicine, the Australasian Facility of Public Health Medicine, the Chapter of Addiction Specialists, and the HIV/AIDS Research Centres. There is also support from the Australian Parliamentary Group for Drug Law Reform and the Australian Drug Law Reform Foundation. The City of Sydney, local youth services, homelessness services and legal services all back this service. Repeated analysis by the Bureau of Crime Statistics and Research showed the MSIC is not linked with crime. It does not supply drugs. It does not condone drug dealing, which is prohibited on site. Medically supervised injecting centre staff are compassionate and caring. I, in fact, think they probably do one of the hardest jobs in the world. They work with some of the most marginalised people in our community. This legislation acknowledges their successful efforts to help people deal with the problems of drug use, and many are able to get off drugs. The former director, Dr. Ingrid Van Beek, and the current director, Dr. Marion Jauncey, have provided strong leadership in a challenging environment. I acknowledge their significant contributions and the contributions of their staff and their key support from the Uniting Care, particularly the Reverend Harry Herbert, which auspices the centre. I also commend the Premier and the Minister for Health for having the guts and to bring this on and to make this trial permanent. And I also commend the work of the former Health Minister, John Della Bosca, who was active at the Drug Summit in 1999, and as Health Minister was also very supportive of the centre. It has at times been a struggle, and this is no doubt considered by some to be controversial. This is in my electorate, and it's something the majority of the people I represent support, and it is compassionate, and it's practical, and it's about people. As the Premier said, these are people that are family members of other members of our community, and I strongly commend, as the local member, I strongly commend this bill to all other members of the House to support this initiative in King's Cross.